Introducing the subject of malnutrition, we should start by talking about nutrition. Nutrition is really a very young science. The word vitamin was not known by the human race until the year 1913, and most of what we know about nutrition and malnutrition has really been learned in the last half of the last century. So it's as far as science and the human experience, the understanding of nutrition is new and it is exploding. We're learning so much, and most of what we're learning has been applied to the feeding of already well-nourished children. The people who need the application of all of the wonderful things that we've been learning live in the developing world where some of that science hasn't reached them. So we should contemplate about that and understand the causes and the remedies for causes, consequences, and the remedies for malnutrition that are applicable to circumstances that are much different in the developing world than they are in high-income countries. Just looking at the beauty of this landscape, there's something that attracts attention. If you notice a farmer's field on the right lower hand corner of the picture, these folks are often farming farmland that has really is pine forest. It's not agricultural land. They used to live in the agricultural land in the valleys, but they were moved because international agro-businesses needed this land. So this is a reality of many of the communities in Central America that are facing chronic malnutrition problems. So the consequences of the malnutrition look different than they do in places that have had the benefit of nutritional science. We're going to do an overview of nutrition and malnutrition. Hidden hunger is our topic. There is trouble in paradise. Even such beautiful places have hidden hunger. This is in the foreground of that beautiful mountain that we were looking at. The problem of hidden hunger. Children living with chronic malnutrition may be in serious danger even when they appear normal. The problem of hidden hunger, it's not just the quantity, but the quality or nutritional value of the food. Doctors Without Borders a few years ago did a major countrywide campaign. They called it Starving for Attention. They set up Doctors Without Borders tents in a number of cities, and they made a huge pitch for our food aid that we're giving to countries that are distributed, where the food is being distributed to malnourished children, should be fortified. We're often exporting unfortified food, and basically it's offering bread and water, grains and unfortified, low-fat, low-nutrient-dense food to children who are desperate for balanced nutrition more than even the children in the developed world. So, in many developing countries, the majority of children suffer hidden. It causes most of the deaths in children under 5, causes many illnesses and most mental retardation from iodine deficiency. It is, we remind ourselves, 100% curable and 100% treatable. So what is it? Who has it? Why is it hiding? How do we find it? What can we do about it? First of all, what is hidden hunger? It's vitamin and mineral deficiency. Now, it's the micronutrient minerals that we're talking about, and we will get to the specifics of that in a minute. So who has it? Oh, about 2 billion people. But it's hard for us to wrap our minds around 2 billion people. But every child suffering from malnutrition is an individual person with a family and a community and a face. So why are so many children suffering from hidden hunger? Many reasons. Infertile soil. People are living often in desertified areas or mountainous areas where the nutrients have been leached from the soil, or it never was good agricultural soil, mountaintops. So that is a huge part of the problem. So why are children becoming chronically malnourished? What's gone wrong? In the environment, adverse farming conditions, poor rainfall, soils depleted of micronutrients. People are eating nutrient-poor food grown in the vicinity of their lack of infrastructure, um, lack of roads and sewer systems and potable water systems. So children are working hard, dragging dirty water up the mountains to be consumed in the homes, sourced from polluted sources. Uh, Poor infrastructure, lack of clean water and sanitation leads to recurrent illnesses with viruses, bacteria, intestinal parasites, and malaria. Malaria from two reasons. The immune system is weakened by malnutrition, and also the environment is sometimes swampy, a lot of breeding places for malarial, mosquito-borne malarial parasites. Um, Frequent diarrhea also causes direct loss of nutrients, and small bowel bacterial overgrowth causes malabsorption of nutrients. Why are children becoming chronically malnourished? Also, an unsafe home environment. Children are exposed to sometimes open sewers, sometimes agricultural chemicals, a lot of parasites, bacteria, human waste, animal waste, and their bodies are not well enough nourished to fight all of these. The pollution causing oxidative stress or burning by the toxins such as agricultural chemicals, cooking smoke, and the fungal toxins in food like aflatoxins. We don't think about that enough. It's becoming more of a public health awareness issue, especially in the developing world, where many of the people are living on grain-based diets. The storage of the grains and testing for aflatoxin contamination isn't being done, and therefore the people are ingesting known carcinogens on a daily basis. There's not enough antioxidant vitamins and minerals in their diets to counteract the oxidizing effect of the pollutants. What's happening on a global scale that is impacting the lives of children suffering from hidden hunger? Well, sometimes we just have to admit this is above the scope of the discussion for today, but is oh so important. International socioeconomic and political forces that deprive families of access to their very basic needs. So many displaced people, people who are displaced by war, climate change, genocides, prejudice. It is the global scale is impacting children and causing the problem of hidden hunger and not so hidden hunger to be worse in those situations. So, what is the impact of deprivation on the lives of children? Lack of education, housing, medical care, and food takes a tremendous toll and may rob them of their chance to survive and thrive. What does malnutrition do? It leaves children defenseless. Malnutrition causes poor barriers or linings of the skin in all the internal organs, so pathogens, viruses, bacteria, parasites can transgress those borders and enter the body more easily. And this has to do with the linings, for example, of the respiratory tract, the urogenital tract, the GI tract, that there is poor healing and poor barrier immunity to disease. Malnutrition also causes poor immunity to fight off infection that has penetrated the child's. Malnutrition causes poor healing and recovery from illnesses and damage. Now, there is another big issue that we don't think of so much in our part of the world, and there's not enough awareness of it really in many levels all over the world. But hidden hunger causes nutritional acquired immune deficiency syndrome. Now, of course, we've all heard by now of the immune deficiency syndrome, acquired immune deficiency syndrome. We call it AIDS. And usually we're talking about the HIV/AIDS, that is an infectious transmittable disease, but the hidden hunger causing nutritional AIDS nutritional acquired immune deficiency syndrome has the same humoral and cellular immunodeficiency as HIV/AIDS. So you have both B cell and T cell humoral antibody deficiency and cellular immunity, which in nutritional AIDS, as you see in AIDS. Nutritional AIDS kills more people on an annual basis than HIV/AIDS. Now I'm going to show you two dramatic, horrible examples that are illustrative of the effect of the immune deficiency in malnourished children. Noma is a dramatic example of a life-threatening disease that illustrates the synergy of poor barriers, poor immunity, and poor healing. Noma is found mostly in the Sahel region of Africa, but it is in Asia. It used to be in the US, but we no longer see it in the US since the early part of the last century. The last cases were seen in an orphanage in New York City. And that was before antibiotics, it was before vaccines, the most common vaccines that we use now. It was eliminated in our country by improved nutrition. It was last seen in Europe when Hitler put people in concentration camps and enforced starvation. And recently there was a Noma case reported in a city in the US in a individual who was extremely malnourished. So we don't see this very often now. It is usually, if seen at all in the developed world, in cases of other diseases that are immune compromising. But this is a very common problem in the Sahel of Africa, and it illustrates what we're talking about. That I bring up these, even though you hopefully never see them, is because they demonstrate the what's happening in the body. You can't see when a child's brain is necrosing with meningitis, or their lungs have necrotic changes from pneumonia, or their bowel from horrible enteric infections. These things aren't visible on the outside, but this is dramatic because it's showing us the consequences, and a visible consequence. In this case, we're talking now about nutritional blindness, which has very similar demographics, similar distribution, similar causes. It's due mainly to vitamin A deficiency, but also multiple micronutrient deficiencies. And this is not seen any longer in the developed world, but it is still encountered in communities fighting chronic malnutrition. Now, acute malnutrition is not hidden, it's easy to recognize, but it only accounts for 17% of the deaths from malnutrition because, thankfully, it is not that common. Chronic malnutrition is hidden, hard to recognize, but accounts for 83% of the deaths from malnutrition. There is great urgency to start attending to children even before the 4th month of the intrauterine development, when the thymus develops. If the child does not have adequate nutrition, they may develop they can develop T-cell immunity, and their risk of having a lifetime of malnutrition, of immune deficiency, the stage is set at that early, sometimes before the woman even knows she's pregnant. 4 months, she may not even realize she's pregnant, but her malnutrition has already affected the intrauterine development of the immune system of her child. So if children are denied a robust intake of micronutrients in their early childhood, they will not achieve their genetic potential. The first 1,000 days after conception are the critical. But attention to the nutrition of all children is urgent. How do we find children at risk for stunting of growth is a marker for impaired immune function, metabolism, intellectual development, tissue integrity, and healing. It is the most easily measurable marker of chronic malnutrition. Failure to grow in height indicates high mortality. Anemia is another very important marker of chronic malnutrition, and it's a marker for the prevalence of all the neglected tropical diseases, parasites, malaria, and it's a major risk factor in maternal mortality. For every point of anemia that a woman has going into her delivery, her risk of dying of maternity, pregnancy, postpartum complications goes up by 20% from her baseline for every point of every gram per deciliter of hemoglobin that she's lacking. So what is anemia? Low red blood cells. Why do children become anemic? Diet, parasites, illnesses that cause loss of blood, inflammation that causes lack of blood production, in other words, the anemia of chronic. How do we find anemia? In our program, we use what is almost never even thought about anymore in the developed world, and that is color scale estimation of hemoglobin. The way back, and probably most medical students going through their training now would not have heard of the Talquist scale, but it was something that was talked about. But it's been replaced in the developed world by automated hemoglobin analysis. CBCs are so easy to come by, and nobody bothers to do a colorimetric test now. But it still works as a screening, a rapid assessment estimation for monitoring individuals and communities. So what can we do about hidden hunger? First of all, we have to understand that malnourished children must consume all 40 of the necessary nutrients in higher than normal quantities. Sometimes we have this crazy idea that the populations living with food insecurity and facing chronic starvation, somehow they don't need as much food as other people do. This idea of the otherness of people suffering from deprivation is a fallacy. Their bodies are metabolically, genetically the same. They need everything. The children who are not used to eating good food, they need the same nutrients as the most pampered and well-loved children in the developed world, and they need more for the following. They need a more robust nutrient intake than do children living in safe places, because first of all, children need the basic normal maintenance level of nutrition for their age, no matter whether their environment is safe or not. Additionally, a malnourished child living in adversity needs extra nutrients to combat chronically present stressors, chemicals, and pathogens. Your body needs the ingredients to neutralize, to be antioxidant, to conjugate, to fight, to produce the immunoglobulins in the cells to fight infections, to repair from infections. All of that requires the stuff that is found in food. Malnourished children have more illnesses during which they enter a catabolic or tissue wasting state. Extra nutrients are needed for healing and rebuilding after each illness. Then for catch-up growth, stunted children need extra nutrients to replete their accumulated deficits since conception. Now, the rate of recovery from malnutrition depends on the availability of nutrients. Energy requirements for recovery are high. A child needs extra calories from carbohydrates and fats, but that is not enough. If attention is limited to replacing calories, the child will regain the lost weight as fat. Without balanced nutrition, including robust micronutrients, children will not catch up in linear growth, replenishment of lost tissues, or restoration of immune. Micronutrients. Now, don't be fooled by their minute quantities. They are very important for the maintenance of homeostasis, meaning the well-balanced organism. Some of these trace elements are cofactors of critical enzymes in the body, meaning that without them, the enzyme cannot work at all, and that even low concentrations of them can make the enzyme work very well. Now, oops, this is a Spanish chart, but this, sorry about that, folks. This is, for those of you who don't speak Spanish, this is the chart of the micronutrients and the disease states that are the result of lack of them. Notice that nutritional anemia has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 necessary micronutrients, not just iron. So we need iron, we need B12, folate, retinol, thiamine, riboflavin, niacin, pantothenic acid, folic acid, I said. And we also need vitamin E and of course iron, selenium, copper, and zinc. We need all of those things to not have a nutritional anemia, not just iron. Food fortification with micronutrients has made populations healthier in developed countries. Think about iodine in the salt. Think about vitamin D in milk. Think about vitamin B in cereals and flours, all the B vitamins in cereals and flours, and the C that's often added to beverages. Um, However, communities combating chronic malnutrition often lack access to fortified foods that are fortified in manufacture because they're not eating manufactured foods, they're growing it. Many families will never have enough access to highly nutritious. There will never be enough nutrition centers or program for all of the malnourished children. So what can be done to make a difference now? What kind of strategies are people recommending and using around the world to help to combat micronutrient malnutrition? In order to combat malnutrition, we must have a feasible community-based approach. The strategy of home food fortification can bring the benefits of nutrition science to those who most need it and can be implemented in the community. Many people fortify their diet with micronutrients. They take a multivitamin, they give it to their kids. But most of us don't add powdered micronutrients to our food on a regular basis. But that strategy is being recommended around the world for a micronutrient fortification program that can be done when the food industry is not able to solve the problem. Now, it is also especially valuable for families to increase food production in their communities. One study showed that families in the Sahel of Africa that had eggs, that had chickens, and eggs were part of their diet, were the ones who were protected from the terrible disease Noma. And also, eggs are an ideal food for fortification. And oh, by the way, they contain micronutrients. They're the most complete, ready-to-eat therapeutic food. They contain all of the micronutrients, and they also contain protein and fat, calories, carbohydrates, and macronutrients. So now we should talk about micro and macronutrients for a minute. The rest of this talk is going to focus on essential micronutrients because they are the main factor in the child survival issue. There are 21 that are essential in health and disease. We should also pause to remember that about the macronutrients: fat, protein, carbohydrates, water, sodium, calcium, potassium, magnesium, phosphorus, etc. We'll touch on the importance of some of these in other sections, especially the macronutrient minerals in the refeeding syndrome. And for those of you who are not familiar with the refeeding syndrome, I hope if you pay attention, you will understand as you go through this course. Now, there's something else that is relatively new knowledge in the nutrition science world, and that is the importance of phytic acid, which is an anti-nutrient. Many people are eating grain-based diets, corn, beans, that are low in essential nutrients, but they are high in phytic acid or plant acid, which is a phosphoric acid that is an anti-nutrient. It is not well absorbed, it's not a good phosphorus sort, it's not bioavailable, but it binds zinc, calcium, iron, phosphorus, magnesium, and protein. It increases malnutrition. So it needs to be inactivated. Soaking, fermenting, and germinating helps to inactivate the phytic acid in the grains. It's a topic under getting a lot of research because it also, oh, by the way, affects the health of people in the developed world who are trying to be healthy by eating a grain-based diet, and they may be sabotaging some of their efforts. Um, all of the nutrients that are endangered by phytic acid are found in eggs. So eating eggs is a good way to approach this, but also there is another reason for this is another reason for home food fortification, to increase the level of the micronutrients in the food that is being fed to the family at home. Now we're going to start going through the micronutrients. We'll start with the micronutrient mineral iron. Deficiency of iron causes anemia and learning impairment, but iron supplementation alone will not correct anemia in many malnourished children. It is better to have a balanced hematinic micronutrient formulation, such as we're going to start talking about iron. Iron deficiency causes anemia and learning impairment. Now, iron alone will not correct anemia in many malnourished children. It is better to have a balanced hematinic formula with the micronutrients folate, cobalamin, riboflavin, pyridoxine, vitamin C, vitamin E, copper, even zinc. There's a few more. High dose iron alone may be toxic to severely malnourished children. And of course, it's a huge cause of poisoning. So having iron tablets in the home that are sugar coated is a very big danger to children. Big cause of overdose and poisoning. Adding iron to food just before serving, home food fortification prevents iron from altering the color and shelf life of food by chemical reaction. Now, there's one subject that is important if you're in a malarial area and children are being given iron supplements. It's better to treat the malaria first. Some people, there's some debate on this. Some studies have called it important, others not. But the general understanding that many people work with is that iron can feed the malaria and give it the nutrients it needs to get the upper hand in the malaria suffering patient. So prevent and treat malaria first before starting iron. So this is like I said, was universal agreement on that one. Now, copper deficiency is common, especially in the Andes, causes anemia, diarrhea, and osteoporosis. Now, it's important to supplement, especially since zinc, which is life-saving, and we'll get to that, can lower the absorption of copper. So the copper and zinc balance has to be correct. It's better, like iron, to mix it with the food just before eating because a chemical reaction lowers other nutrients' shelf life. When environment is contaminated by excess molybdenum, copper deficiency can occur, making supplementation even more important. Now, here's a problem. We often don't know because the studies haven't been done or haven't been applied to the public health world, the knowledge base, that we don't know where we are working all the time. What are the deficiencies in the soil in that region or in the population in that region? So that is another vote for a balanced, comprehensive, complete micronutrient formula. Now, selenium is another micronutrient that is extremely important. It is soil dependent. It is the levels in plants and animals depends on the level in the soil. In Africa and China, but also in the wet tropics, the Caribbean, and Central America, there are widespread areas where selenium deficiency is a problem. Now, as with combined with iodine deficiency, it can cause larger goiters. And there's two diseases which, of course, we don't really see in our population, but they have been widespread in other countries and controlled by public health intervention. But white muscle disease, which is Cushing black cartilage, and Casson heart disease may be due to increased pathogenicity of Coxsackie virus. Now, the selenium deficiency in the populations at risk is an important public health concern because selenium repletion may prevent viral mutations to more virulent strains. So this is a little bit esoteric, perhaps, but it deserves our attention as people interested in public health, that we shouldn't neglect the possibility or overlook the possibility that deficiency may be making viral epidemics more virulent. Now, the selenium also gives important protection against the oxidative stress of toxin exposure infections, and it is critical in the survival of kwashiorkor patients. Now, if you aren't familiar with that, we'll get to that later. In the U.S., corn especially is sometimes deficient in selenium, and donated food for aid may be selenium deficient, which is an example of why fortification of foods used in feeding programs is essential. Now, iodine deficiency, widespread, used to be huge in the Great Lakes region of our country. And I am from Wisconsin. My mother and her family grew up in Lake Superior region. All of my mother and all of her sisters had goiters because they lived in that part of the world. We don't see it anymore because our salt is iodized. And we also don't see cretinism, growth impairment, and mental retardation because of iodine deficiency. Communities that suffer from iodine deficiency, once the iodine is in the salt and it is part of public health interventions, the IQ of the community can rise dramatically, the average IQ. Although the damage from cretinism is permanent, children born to iodine deficient mothers are impaired for life, which is tragic, and also the mental retardation is the most common cause of mental retardation on the planet, is iodine deficiency. Thiamine, B12. Now, in B1 rather, in adults, cardiovascular nervous system, especially in alcoholism, Wernicke, and Korsakoff syndrome, but in children, heart failure, vocal paralysis, marasmus, vomiting, diarrhea, convulsions, pallor, irritability. It is associated with white rice, raw fish, betel nuts, bacterial fluid, and chlorine. The cooking destroys up to 60% of the B1. Riboflavin, B2. It's found in meat, milk, and green leafy vegetables. Deficiency is common. It was documented in 80% of normal Jamaican children. Anemia, children with low riboflavin will not recover with just iron supplements, and malabsorption worsens malnutrition. Niacin, B3. Now, we don't see this disease in the phototoxic rash of niacin deficiency in most of the world. It is seen in corn and maize-based diets, including Food Aid, which is corn and soy blends if it's not fortified. You will see diarrhea, cerebral dysfunction, dementia, and pellagra. This is the phototoxic rash of niacin deficiency. Soaking corn in lime, as they do in Central America, but not in Africa, can help prevent the deficiency. And frankly, if you ask me why, I can't tell you. Lack of dietary niacin alone does not cause pellagra without the lack of tryptophan found in milk, pyridoxine, riboflavin, iron, and zinc. The children may be growing normally, but they have this vitamin deficiency evidenced by the rash. We don't see this in our country anymore. So you have to find pictures from the developing world or old textbooks. This is not something we're going to encounter in our country. Pyridoxine B6. Now, this is a fascinating subject. A deficiency can cause seborrheic dermatitis, anemia, fatty liver, mouth lesions, neuropathy, seizures, and mental changes, and may not be recognized. Now, in animals, baby rats with their babies. Low levels of pyridoxine can affect the mother and child in the rat couples, and it is felt probably also can affect the bonding behavior and of mothers and children, human mothers and children, and could impair the success of programs aimed at improving the care of children. A mother who is pyridoxine deprived may not be as attentive to her children. Now, what's interesting is we kind of feel like behaviors should be, we should just be able to tell people to do something different. But so much of our mental state is biological. The hormones and the relationship between mother and child is not just taught, but it's also biology. And malnutrition causes mental changes, causes lethargy, causes learning problems, and may, in this case, cause difficulty with maternal behaviors that we think are teachable or at least instinctive and indestructible. Now, it's not very bioavailable from grains or beans, and it is even low in breast milk in many poor communities. Vitamin B12, cobalamin, is not found in plants, so it's absent in vegetarian diets. Synthesized in the GI tract efficiently in ruminants, cows, and goats. It's been found to be low in breast milk in Guatemalan women. It, of course, causes anemia. Absorption is affected by stomach and bowel disease. Now, here's a really serious thing that is not well recognized, and we don't think we're seeing it in the developed world. But if a person is B12 deficient and she gets very high dose folic acid without B12, she may develop, and this is usually women we're talking about who are grain-based diet, and then they're given folic acid supplements during pregnancy, they may develop severe irreversible spinal cord damage or dementia, even without anemia. Now, this is a very important public health consideration and another point in favor of using balanced micronutrient formulas, not just the micronutrients iron and folic acid for pregnant women in developing countries. So we should be strongly pushing for the use of B12 in people trying to live on a grain-based diet, especially if they're being given folic acid during pregnancy. Now, folic acid B9 is common cause of neural tube defects. Bioavailability of folic acid requires good levels of iron, vitamin C, and zinc. The zinc-dependent enzyme in the intestine that helps with the B12 absorption is inhibited by beans, corn, and bananas. It's lost in sunlight and cooking, but levels are higher with good levels of iron, zinc, and vitamin C. Another strike in favor of a balanced multivitamin formula. Ascorbic acid, vitamin C, fresh fruits, green vegetables, enhances iron absorption. It's antioxidant, which is important in a polluted environment and smoke exposure, destroyed by prolonged storage of the harvest, and people get scurvy and the scorbutic rosary. That is the lumps that you're seeing in the rib cage of this very malnourished child. Vitamin E, fat-soluble antioxidant protecting cell membranes, brain, essential fatty acids, and immune system. Works with selenium to combat viral illnesses, relatively low in breast milk, and whenever it's been measured in malnourished children, is found to be low associated with a low-fat diet. Retinol, vitamin A. This is, if there ever was a magic bullet in malnutrition, it's vitamin A. Vitamin A has capsule distribution has been a widespread and widely recommended and accepted strategy for improving child survival for so many reasons. Deficiency of vitamin A is major component of hidden hunger, causing blindness, nutritional blindness, and we'll talk about that later. mucosal surface dysfunction, loss of integrity, the mucous membranes of the eyes, the sclera and conjunctiva, the respiratory system, the GI system, GU system, the skin, all of the epithelium and endothelium of the body does not develop well with vitamin A deficiency. Therefore, children have poor barriers, they have poor healing, they have immune system dysfunction, both B cell and T cell, humoral and cellular immunity. They have nutritional aids with severe deficiency, failure to grow, and mortality goes way up. Doses have been well studied, and safety of the megadose when used correctly is well established. And now capsule distribution programs around the world are well accepted as part of child survival strategies. And however, many times, even though they are part of the norms of the Ministry of Health, the application, the implementation can be lacking, and that can be a role for nonprofits who become advocates for the needs of the malnourished children. Vitamin D. Now, most vitamin D deficiency, surprisingly enough, is seen in hot, dry, dusty climates. You would think where the sun is shining every day that the children would be getting a lot of vitamin D. However, the dust in the atmosphere can block the sun's rays. Children can develop rickets with the swelling of the joints, the rosary in the chest that we just saw, the scorbutic rosary. It looks similar to that with vitamin D deficiency. Bowed legs, like wrist swelling. We haven't seen vitamin D deficiency disease in our country for a long time since milk has been fortified, but still there were some lingering cases of farmers giving their children unenriched milk over the winter when they weren't getting the sunshine. And so there have been lingering into our era some cases of vitamin D, but we rarely see it. It can occur in breastfed children, and a cultural practice of keeping sick children indoors and covering them when they're outside can contribute to vitamin D deficiency. Immune system and cardiovascular health is becoming more recognized, and of course we know about the role in bone strength. Biotin, vitamin H. Now, uncooked egg whites combine combined biotin. Infants with biotin deficiency have lack of facial fat, skin rashes, flat affect, withdrawn social behavior, looking like severe zinc deficiency and kwashiorkor, and severe hair loss is often seen in malnourished children. Does biotin deficiency contribute to the clinical picture of malnutrition more than we really used to realize? Recommendations vary widely, but high levels are not toxic. The dosing recommendations are quite variable. Pantothenic acid, B5. This was a demonstration of the need for fortifying donated food aid. Afghanistan refugees relying on donated, refined, non-fortified wheat flour developed pantothenic acid B5 deficiency with painful neuropathy. It's recommended for fortified food programs for safety. Manganese, chromium, molybdenum, and fluorine. Manganese deficiency is noted in epilepsy associated with anemia, skin lesions. What does it all mean? Chromium relates to carbohydrate metabolism. Molybdenum is a cofactor for enzymes involved in energy production. And fluoride has a role in dental enamel, but there's excess fluorine in many parts of Africa causing staining and fluorosis. Choline, this is a kind of a thing that we're learning more about. Deficiency causes neurologic dysfunction and fatty liver in animals. Most diets used to address malnutrition do not contain added choline, and fatty liver may persist in children even during rehabilitation. Eggs are an excellent source and can be incorporated into strategies to combat malnutrition. But we don't know everything we're going to know someday yet. So this is kind of the many things that we know right now. but it doesn't mean that the last has been written. Now, there will never be enough nutrition centers for all of the children. Children born into adversity can survive, thrive, and grow to be happy and productive members of their families and. Thank you.